So hello and welcome to a medical insurance info session for international students at SFU. My name is Ashani and I'm an international student advisor for programs and settlement. I'm joined today by my colleague Ali from Student Care, who will present on secondary medical insurance. Thank you all for being here today. For those of you who are watching the recording, please note that the auto caption functionality may not be 100% accurate. I would like to respectfully acknowledge that Simon Fraser University is located on the unceded traditional territories of the Musqueam, Squamish, Tsleil-Waututh, Katzie, Coquitlam, Kaikite, Kwantlen, Simimu, and Tuasun nations. So, medical insurance at SFU. As international students at SFU, it is possible that you're navigating a healthcare system that is new and unfamiliar to you. So medical insurance is an extremely important topic, and in this presentation, we will give you an overview of how health insurance works in BC and explain the different types of medical insurance plans that you need to have during your time at SFU. So to give you kind of like a brief background, so there are two types of insurance, primary and secondary, and together they make up your comprehensive health insurance. So as international students, you must have adequate medical insurance for the entire duration of your studies. If family members are accompanying you, they should also have sufficient medical insurance during their stay in Canada. Medical services can be extremely costly without valid insurance. So for example, if you look at the BC MSP website, it indicates that hospital cost alone can exceed $1,000 a day. As such, it is in your best interest to ensure that you have valid medical insurance coverage at all times. So what's the difference between primary and secondary medical insurance? So primary medical insurance covers medically required services, such as visits to doctors, hospital stays, and any diagnostic medical testing you might need, such as x-rays or lab tests. So primary medical insurance is legally required for all residents of BC, including international students such as yourselves. So your main primary insurance would be the BC Medical Services Plan, also referred to as the BC MSP, and that's administered by a government agency known as Health Insurance BC. Secondary medical insurance generally covers extras or like add-ons that are not covered by primary medical insurance, such as dental services, vision care, and prescription drugs. So eligible SFU students receive secondary medical insurance through the SFSS or GSS Health and Dental Plan. So let's just focus on primary medical insurance first. So this diagram here shows you a general timeline for primary medical insurance for international students who have newly arrived in BC. And we will use the fall 2022 term as an example. So new students who have arrived in BC should apply for BC MSP right away. There is a waiting period of 2 to 3 months before your MSP coverage will be effective. So to cover this waiting period, SFU provides a temporary primary medical insurance plan, and that's called Guard Me at SFU. So if you're a new student who started at SFU in the fall 2022 term, your temporary primary insurance coverage through Guard Me has already started, and it started on September 1st, and it will be valid until December 31st of this year. So you were automatically enrolled in Guard Me after you completed your course enrollment. And then depending on when you arrived in BC, your BC MSP coverage start date will be different for each person. So if you apply for BC MSP right after arriving, say in early September, it will be effective towards the end of your semester, and you might have some overlap between your Guard Me and BC MSP coverages. So we will go into a little bit more information about the differences in the two plans. So Guard Me at SFU, as I mentioned earlier, is a temporary primary medical insurance plan. The goal of the Guard Me plan is to ensure that you have coverage while you're waiting for your BC MSP to be effective and to allow you to have immediate access to medical services if you need it. So as international students at SFU, you are automatically enrolled in the Guard Me plan for your first term. So you don't need to take any action on your part. You have automatically been enrolled. You can see the coverage dates on the screen based on your semester that you start at SFU. What you need to know is that you get enrollment through GuardMe only for your first semester. We will not enroll you in any subsequent terms. The cost of the GuardMe plan is $281, and it is part of your SFU fees, and your fees will be due by the fee payment deadlines. You can enroll your dependent family members, if you have a spouse, a common law partner, and children, in your GuardMe plan as well at an additional cost. So if you would like to enroll any dependents, you can just go to the GuardMe website online and add them to your policy. So all students in their first term at SFU will receive a welcome email from GuardMe. So this email will include a link to your GuardMe online account, and you can log in to view your policy details and submit your claims. And you can also view and download your healthcare access card, which is your proof of insurance. And for your first semester, we do recommend that you print a copy of this and carry it with you all times. So some clinics might do direct billing, so you can just present the card if it's one of those clinics, or you can use it to submit a claim later if you have any expenses. So opting out of GuardMe, if you happen to be a student whose first term at SFU is this current fall 2022 term, but you are studying remotely outside of Canada, you can opt out to get the full refund of $281. And to opt out, you have to go into the GuardMe website and complete the out-of-country opt-out form. And if this applies to you, you just need to make sure that you have valid insurance when you arrive in BC, say for the next semester. So you can just get in touch with our office and we can kind of explore the options you might have to get you coverage while you are waiting for your BC MSP. It's also possible that you already have valid BC MSP if you have been living in BC for a while. For example, you could be a transfer student from FIC or another post-secondary institution. And if this is your case, you can also opt out of the GuardMe plan by providing proof of your MSP coverage. So to get the full refund, you have to opt out before September 30th. To be eligible for a refund, you must have not used your GuardMe plan. And if you're a brand new student, you might be eligible for a partial refund if you receive your valid BC MSP before November 30th, and you also opt out before November 30th. And again, to be eligible for a refund, you must have not used your GuardMe plan. So that gives you an overview of your GuardMe insurance. What's really important to remember is that your GuardMe plan is temporary and it is for your first term only. You need to make sure that you will have valid BC MSP to be effective by the time your GuardMe plan expires, so that you will have continuous primary medical insurance coverage. Okay, so moving on to BC MSP. So BC MSP is your provincial primary medical insurance plan, and that's provided through a government agency known as Health Insurance BC. So it is a legal requirement for all students who are studying in BC for longer than 6 months to enroll in BC MSP. So unlike GuardMe, enrollment in the BC MSP plan is not automatic and it cannot be done through SFU. And if you're physically in BC and you haven't applied for BC MSP already, please do so right away. And you can apply for BC MSP online. And if you haven't arrived in BC yet, please make sure that you apply for BC MSP as soon as you arrive. If there are any students here who are past their first term at SFU, meaning you no longer have GuardMe insurance, but also have not applied for BC MSP, please get in touch with our office for further advice. So as we mentioned earlier, all new BC residents must fulfill the wait period of roughly 3 months before your MSP coverage can be effective. So for example of how that timeline works, if you arrived in August, the waiting period would be the balance of the days left in August plus 2 more months, which would be September and October, which would result in your BC MSP being effective from November 1st onwards. So the GuardMe plan will provide you primary medical insurance while you're going through this waiting period. To apply for BC MSP, your current study permit must be valid for a period of 6 months or more. If you have any dependents, they can also be added to your plan when you apply for it. The cost of the BC MSP plan is $75 per month, for all study permit holders. So this fee is known as the International Student Health Fee. You will receive the invoice monthly by mail, and you can make the payments online. You can use credit cards or direct deposit or direct debit. There are a few different options. So this charge does not appear on your SFU student account, and you are responsible for making the monthly payments and maintaining your account. So the information on this slide will not apply to everyone, but I saw a large number of graduate students who have registered, and I know some of you are present today as well. So I just want to touch upon this and provide you with some resources. If you end up becoming a teaching assistant or a tutor marker or otherwise a TSSU member, you can have the International Student Health Fee for MSP covered by SFU as part of your employee benefits for the duration of your TSSU contract. TSSU benefits are not automatic, and you will need to apply for it through SFU Human Resources. What's important to remember is that you will have this fee covered only for the duration of your contract. So once you are no longer a TA or a TM, you will be responsible for making the monthly payments and maintaining your MSP account again. So if you have any further questions about enrolling in any of the human resources benefits, please email tssubenz@sfu.ca. And once you receive your MSP coverage, you must ensure that you keep your MSP account current and updated. As an international student, your MSP coverage will be valid only until the length of your study permit you apply for BC MSP with. As such, it's important to remember that each time you have to renew your study permit, you must also ensure to extend your MSP coverage. So you can request for temporary MSP coverage for an initial period of 6 months if you applied for a new study permit before your old study permit expired and you're waiting for it to be processed. Then once you receive your new study permit, you can apply to extend your MSP coverage for the entire validity of your new study permit. And managing your MSP account also entails updating your address if you move so that you won't miss out on any important correspondence and ensuring that you're making your monthly payments. You can do all this online by visiting the MSP website. So that covers all the information about primary medical insurance. Ali will now present to you about secondary medical insurance. Over to you, Ali.
Wonderful. Thank you so much, Ishani. Ishani gave you a presentation on primary medical insurance. I'm going to be giving you a brief orientation on the secondary medical insurance. And this plan is different whether you are a graduate or undergraduate student. And so the information that I've presented in the slide here is sort of general information. If you would like to know the specifics of your plan, I invite you to go to our website, studentcare.ca, and you'll be able to see the specific details on that. So just kind of to start off with a quick overview, the extended or secondary health and dental plan is there to fill in any gaps that are not covered by provincial healthcare or any other basic healthcare services. So things that are not covered by MSP or GARDME would typically be covered by your extended health and dental plan. And just as a quick reminder, international students are also required to enroll into BC MSP so that your extended medical insurance, particularly those for prescription drugs, are working simultaneously. So just as an example of things that are covered under your plan, as you can see on the screen over here, you've got 4 broad categories. You've got a health plan that covers you for things such as prescription drugs, vaccinations. If you need to see any mental health practitioner, such as psychologists, they are covered under this plan as well. And then you have physiotherapists, massage therapists, chiropractors, and so forth, who are covered under your health plan. You've got a dental plan as well that covers you for up to $700 annual maximum for things such as cleanings, checkups, examinations, any periodontic or endodontic services. So extractions, fillings, gum treatments, root canals are all covered under your dental plan. You've got a vision plan that covers you for eye exams, contact lenses, and eyeglasses as well. And lastly, you've got a travel plan that covers you for any medical emergencies that you encounter when you are traveling abroad. Just to kind of go back on the travel insurance part of your plan, you have a travel insurance in 2 portions. One is related to academic travel, and the second one is related to non-academic travels. So when you're going on an academic trip, let's say that is an exchange, an internship, or a study abroad semester, you will be covered for the entire duration of that trip, regardless of how long that is. You will have to obtain a letter from student care giving you a proof of coverage. Most likely your host institution will ask you for that letter. You will be able to request that letter online on our website assistance center. When it comes to non-academic travels, so any travels that you're going for on a leisure, you will be covered for up to 120 days per trip, and there are no limits on how many trips you can take in a given year. Since all of you here are international students, it is important to note that the travel insurance does not apply to you in your home country. The reason behind this is that most people already have health insurance provided to them by the government at home, similar to how that practice is here in Canada, where you have health insurance provided to you by the government. Next slide, please. Yeah. So if you are an undergraduate student, your plan costs $267.08, broken down by health and dental, as you can see on the screen over here. Since all of you are enrolled in September for courses, you are automatically covered under this plan, and you have paid for this in your tuition fees. So I advise you to go to your tuition fee statement and just make sure that you see a line item for your health plan and a different line item for your dental plan. Once you see these two figures there, you can rest assured that you are covered under the plan. Next slide, please. The graduate plan, if you are a graduate student, costs $465. Same deal. I invite you to go to your tuition fee account and see that you have been billed the health and dental plan fee. And if you see that amount there, you can rest assured you are covered. You also have an opportunity both for undergrad and grads in case you want to enroll any family members into the plan. So for, there's an additional cost for enrolling one dependent and an additional cost for enrolling unlimited dependents. So depending on your situation, there is a deadline for doing that, which I will highlight in the next slide, but that option is available to you if you so choose. Next slide, please. And so the coverage period has begun on September 1st and will go on until August 31st of next year. So you are covered for a full year, full academic year when it comes to your health insurance, your extended health insurance. The change of coverage period for this intake, that is the fall intake, is August 30th until September 20th. And so if you wanted to enroll any dependents and family members into the plan, you will be able to do that before September 20th. In case you wanted to opt out of the plan, you will be able to opt out before September 20th as well. And if you wanted to coordinate your benefits, that is something that you can do online as well during the change of coverage period. Next slide, please. So the process for opting out is simple. You just go to the website, you submit a proof of coverage by simply taking a picture of your policy document or a letter from your insurer or your employer or any sort of provider. Put that on the website, upload it, and you will receive a refund in your tuition fee account. Next slide, please. And so there are a couple of ways in which you can claim any benefits. The first one is a pay direct card. So the pay direct card is something that you can pick up from the ISS office or the student care office, or you can take a screenshot of this from our website as well. It has your policy number, your group number, and your student ID. These three pieces of information is what the practitioner will use to bill the insurance company directly. So let's say, for example, you go to a dentist to get a cleaning procedure done. You will be able to present this card and the dentist will bill the insurance company directly. This reduces the amount of paperwork you have to do and you don't have to worry about submitting a claim later on. The second way in which you can submit a claim in case the pay direct option does not work is the PBC mobile app. So this app is available for download whether you're an Android user or an Apple user, and you'll have to register an account, sign up, and once you create your account, you'll be able to submit all your claims electronically and choose whether you would like to receive your reimbursement via direct deposit or a check in the mail. Whichever option you choose, that is available to you for an electronic claims submission as well. And lastly, you've got the online forms, which is the most traditional way of submitting claims. You'll have to print out the form, fill it out, scan it, and or rather mail it back to the insurance company. All the policy numbers and the address are listed on the website for your convenience as well. One thing I should note in this slide is the blackout period. Since most of you here are new students starting in the fall, there is a blackout period, which is essentially the time that the insurance company takes to receive your information and upload it into their database. And so if you are accessing any services between September 1st and mid-October, the insurance company might not have your information uploaded in the database yet, and so they will not be able to process your claims. That doesn't mean that you are not covered. It just might take them a little bit more time to receive that information and process the claim. However, after mid-October, you will be able to carry on as usual, and your claims will be paid out almost immediately. It's just that during the blackout period, that process does take a little bit longer, and so the insurance company will not be able to verify whether or not you are enrolled in this plan. So that's just one thing to keep in mind of, is the blackout period that goes on until October 15th. Next slide, please. The next thing I want to talk about is student care networks. A network is the student care network is basically a group of practitioners who have partnered with us to provide you folks with additional savings and discounts whenever you do go to access these services. I should note that it is not mandatory for you to go to a practitioner who is part of the network. If you have a practitioner that you prefer to go to and you have been going to for a long time, perhaps you're more than welcome to continue going to them if they are not part of the network, and you will be covered for the insured portion of the plan. However, as I will explain in the next slide over here, you will get additional savings and discounts when you go to practitioners who are part of the savings network. So as you can see on the screen over here, I have demonstrated that with an example of a dental network. If you go to a dentist and you get a preventative service done, let's say you get a cleaning done, your insurance plan covers you for 80% of that service. If you go to a dentist who is part of the savings network, you get a 20% discount, and that means at the end of the day, you don't have to pay anything out of pocket because you are covered at 100%. And so the same formula applies for basic services. Now, the amount varies over here, whether you're a graduate or undergraduate student. So once again, I invite you to go to the website and just double check the specifics of your plan. But you will be covered at between 70 to 80%. You still get the 20% discount. And at the end of the day, you would be responsible for paying, a 10% out of pocket or $0 out of pocket, depending on which plan you are enrolled in. And if that service is not covered under your plan, you will still get that discount, and that really helps reduce your out-of-pocket costs when you are accessing these services. Next slide, please. We have an office in the Student Union building. We are located in room 2301. So if you ever need any help with submitting any claims, or you have questions about accessing your plan in general, please feel free to drop by there Monday to Friday. We're there from 9 a.m. to 5 p.m. And our agents will be more than happy to help you with any questions with regards to your plan. If you prefer to access help online, we have an assistance center online as well. So once you go to the website, under the drop-down menu, you can select whichever association you are a part of, whether you're an undergrad, that would be the SFSS, or if you're a grad student, that would be the SFU GSS. And you'll be able to go to the assistance center and type in your question, and someone will be able to help you out there. And with that, I will pass it back to Ishani.
Yeah, thanks so much, Ali. So that kind of covers all the information we had about your comprehensive medical insurance plans. Before we move on to our Q&A, I did want to inform everyone about health and counseling services that's available to you as an SFU student. So some of you had asked where you can find a doctor if you need to access medical services. SFU has 2 medical clinics at the Burnaby and Vancouver campuses, and the medical team comprises of doctors, psychologists, mental health nurses, and clinical counselors. Their services are offered both in person as well as virtually. You will need to make an appointment to access their services, and you can do so by calling the numbers that you see on the screen here. So that brings us to the end of our presentation. We will move on to the Q&A, and as such, we will also end the recording. For those of you who are watching the recorded version of the session, thank you so much for watching, and please do connect with us if you have any follow-up questions.